Hi, I'm Gail Flood. I am an educational audiologist from Learning Center for the Deaf with the Public School Partnership Program. Today I'm going to be talking about educational considerations for students who are deaf and hard of hearing during COVID. With the return to school and the new norm, we will encounter new obstacles for the hard of hearing students and their teachers. Factors to consider with our return to school are now face masks and social distancing, which brings about new challenges. Two important health and safety recommendations according to the CDC are face masks and social distancing of 6 feet or greater to reduce the spread of the virus. Both of these bring additional challenges and barriers to students and teachers, especially for those who are hard of hearing. Cloth face coverings present difficulty for all students. They will miss learning and social opportunities because of the degraded speech signal that occurs from the mask covering the face. Some of the sound is going to get dampened into the mask, and some of the sounds will become distorted. The mask also impacts speech reading, the ability to see the face and the expressions of the speaker, which leads to some of the intent versus content of a message. Teachers will often experience vocal strain as they need to now talk louder to compensate for the mask. Transparent or clear face masks provide better visual cues to help intelligibility by aiding speech reading and facial expressions. Although clear masks tend to fog up and dampen sounds, studies with hard of hearing adults have shown an overall increase in speech intelligibility and is a preferred listening experience. This must be considered as an alternative for young students and hard of hearing students. For young students who are learning phonemic awareness and learning sounds that make up the words for reading readiness, it is important that they can both see and hear the sounds. For students who are hard of hearing, it is also important that the students are getting all of the correct sounds and not filling in what they think they may be hearing. So, for example, in science, the students are making a volcano, and the teacher tells them they will be needing baking soda. However, the student hears it as bacon soda, a completely different ingredient. Keeping socially distant as we go back to school will bring about new challenges. It is important to remember the limitations of hearing aids and cochlear implants. Speech that is more than 5 feet away from the hearing aid or cochlear implant cannot be understood as clearly as speech that is in closer range. With social distancing of being greater than 6 feet based on the CDC guidelines, this presents a significant problem to our students. If you see the bottom right-hand side of my screen, it says, "This is what deaf or hard of people feel when hearing people speak to them. It is hard work." We are filling this in because we are able to predict what this is going to look like. But imagine a young student who may not be able to predict the words when they are distorted or when they reverberate. It becomes a lot more work and a lot more fatiguing. Social distancing decreases the decibel level of the signal reaching the listener, resulting in reduced access to the critical speech cues. Audiologists refer to the best range of hearing as the listening bubble. Speech that is within the bubble, speech that is within 5 feet of the student, will be perceived at best. Sounds outside of the bubble, sounds greater than 5 feet away, will be too soft or inaccessible and have a significant impact on learning. The use of a microphone headset will increase the strength of the signal to help make up for what will be lost in the mask and decrease vocal strain on the teacher. What about assistive technology? We've used it in the past. Are we still doing this? Yes, we most definitely are, especially now. As you can see, there are several types of hearing assistive technology. We have personal systems that couple to the student's hearing aids or cochlear implants. And then we have sound field systems that are speakers situated within the classroom. With personal ear level assistive technology, the teacher wears a microphone, and the student has a receiver which connects to their hearing aid or cochlear implant that picks up the teacher's voice directly into the hearing aid. With sound field technology, the teacher wears a microphone, and speakers are placed in the classroom. The teacher's voice is able to be amplified louder and above the noise levels of the classroom throughout the classroom. This will improve the listening environment for all students in the classroom. What do we do with the microphones that are going from one teacher to another? Disinfecting, sanitizing the transmitters is recommended using a water-based solution. Bleach containing chlorine or peroxides are not recommended, as this may damage the microphone. How to clean. Wipe the device with a disposable towel soaked with the disinfectant. Never spray the disinfectant directly onto the device. Never immerse the microphone in disinfectant. Discard the towels in the waste paper basket with a lid preferably. Make sure the microphone openings are never in contact with the liquid, as this may damage the electronic components inside. The COVID pandemic has forced many schools to provide educational services through remote learning. Remote learning has its own challenges for students who are hard of hearing. When remote teaching, for best hearing access, it is recommended that a microphone or headset are used so it will bring the teacher's voice closer to the microphone for greater clarity. Be mindful of the rate and intensity of your speech, speaking naturally but clearly. Keep background noise to a minimum when teaching. Repeat peers' comments and questions for everyone at home to hear. For best visual access while teaching remotely, speak with full face view to the camera. Avoid looking down. Avoid having your hands near your mouth. Be sure your face is well lit. Avoid sitting or standing where the light is at your back. Provide visual cues to supplement auditory information. When reading a book aloud to younger children, use a split screen mode. This will allow students to see the teacher's face for speech reading and the book to follow along with. For older students in a more lecture-style learning environment, it's still important to use a split screen. This way the students can access the information that you are sharing, but they can see your face for speech reading cues. Audio access etiquette. Have students mute their microphones and unmute their microphones only when they are speaking to the class. Facilitate a one talker at a time rule. Encourage students to use a signal, for instance hand raising, and wait to be called upon before they unmute. Teach students to be mindful of the background noise in their own home environments. Provide videos with closed captioning whenever possible. Learn to add captions to your own videos. There are third-party captioning services that provide the most accurate captions and may be necessary for some hard of hearing students. Automatic captions are imperfect and may contain errors. Google Hangouts and Google Meet provide automatic captioning in real time. Zoom does not. However, it may be necessary for you to help your student obtain captioning through a separate platform such as Web Captioner at their end during video instruction. School equipment can be used at home. Hearing assistive technology can be sent home and can be plugged into the student's computer or tablet using a 3.5 millimeter male-to-male cable. This may mean that the school's equipment is sent home for the student to use to stream to their hearing aids or cochlear implants. If a student's equipment is going to be sent home, please check with your educational audiologist that all of the needed parts are sent home with it. If the student's hearing aids or cochlear implants have Bluetooth capability, you can pair the hearing aids directly to the computer or tablet at home. Families can check with their dispensing audiologist to assure that they have this capability. If this capability is not available, then the school equipment would be the next best. The educational audiologist can connect to students and their families remotely to assist with the technology. The audiologist can also connect remotely with teachers to assist with any technology questions or issues at their end. We can also observe the classrooms remotely so that we could provide feedback in real time to best assist each individual child and teacher. Please remember that this won't be a one-size-fits-all. This is a work in progress. Remain flexible. Consult your educational audiologist for specific suggestions on how to optimize communication for all your students, for all your teaching platforms. Thank you. I look forward to supporting all of you throughout this new norm.